Medical personnel of Reddit, what was the most uneducated statement a patient has said to you? I just remembered a second story. This girl came to the pharmacy to return her birth control. I asked her why. She said she got pregnant. I asked if she took it every day. She said, no. On the days I didn't feel like taking it, I made my BF take it. I couldn't believe the stupidity. I made them answer a bunch of questions until they realized how stupid they were. A mother requested a maternity test for her child. Not a paternity test, but a maternity test. She was convinced that her husband put another woman's semen in her when she was sleeping. You read that correctly. People who think I am taking their vital signs at 4 a.m. to make more money. No, you just had open heart surgery 12 hours ago. It's kind of a serious thing. My friend has just graduated as a doctor and did a placement in Cape Town, down in South Africa. Apparently things get a little crazy on Friday nights, and one night they had a guy come in, presumably in an ambulance, with an axe lodged in his head. The patient didn't survive. A few hours later another guy came in and asked if he could get his axe back. They said, certainly sir, wait right here, and called the police. Drawing blood. I had an older woman say, wait, you're going to put it back, right? No, I'm not. And she freaked out. She didn't know the body. We'll replace it. Edit. Spelling. Once had a patient who was prescribed an inhaler for his cat allergy. He came back a week later saying he was none the better. Turns out he was spraying the inhaler on his cat. When I worked in the Canadian Rockies, we had an incident where a mother sprayed her kids with bear spray as they thought it was a repellent-like bug spray. It was 99% cayenne pepper with a 9-foot range. After looking at the patient's chart and seeing she had diabetes. ME. Do you have any medical conditions? Patient. No. Me. Are you sure? You've never been told you had any diseases? Patient. Never. Me. What medications do you take? Patient. Insulin. For my diabetes. I had asthma when I was a child. So stop fucking patronizing me and telling me how to raise my daughter just because you think you're smarter than me. Leaves hospital. Back in hospital 2 hours later, 6-year-old daughter in respiratory failure and admitted to IQ. I gave her insulin because her sugar was low. Also dumping ice water on overdosed heroin addicts. That just makes the paramedics wet. As someone with a mom who has type 1 diabetes, I find that terrifying. On a similar note, a lady once tried to give my mother Splendo when her sugar was low. An old man from a remote valley thought that he had got Parkinson's disease because he had been masturbating frequently when he was younger. That's what the church told the young boys to keep them from doing it. Poor guide. I'm not a medical person, but I once thought I was having a heart attack at work and drove myself to the I was placed in a bed with a curtain after skipping triage and getting EKG'd right in the hallway. Of the 5 other roommates separated by curtains was a 53-year-old man that was there for burning sensation in his penis. I know this because multiple people came to talk to him about his condition and he had no volume modulation. What everyone kept asking him was, did you put something chemical in your penis? His response to each one was, yeah, I might have. It took 5 nurses and a doctor before he finally fessed up to what it was. Bleach. He said he dribbled bleach into the tip of his penis to keep from getting an STD. The nurse was silent for a few solid moments before asking why and if he did this every time he was sexually active. He said he wanted it clean, and that he wasn't sexually active at the moment. He wasn't sexually active. He had done it after masturbating, and was under the impression his own semen could have infected his dick with something he didn't want. She then had to lecture him that if he wasn't sexually active with another person, he likely wouldn't contract an STD, and that soap and water are a good way to clean his genitalia in the future. I was frozen in my bed making that face from Edward Munch's The Scream Man, my now ex-wife mirroring it back to me. The man was moved elsewhere, perhaps to rebuild his urethral lining, and we were still too shocked to discuss it until leaving the hospital for hours later. Nurse here. I once had a 20-year-old female patient who didn't know that having sex would lead to pregnancy. She had no idea. My in-laws belong to a very fundamentalist branch. There was one girl in the parish whose parents never talked to her about sex because she might get ideas. She was taught that when the God thought you were ready, he would give you a baby. Sex feels good. And if it wasn't for risk of pregnancy, social stigma, and STDs, we'd all be having a lot more of it. Since she didn't know about those things, she ended up knocked up in HS. She was very excited because God thought she was ready and couldn't understand why her parents threw her out. Told her, ignorance breeds ignorance. Literally. At my animal hospital, I've had many people over the years bring in their cat because they found tumors, not knowing that male cats have nipples. I'm never going to have a baby because the hospitals don't wash them anymore. She's 30. My non-diabetic patient with a blood glucose of 1250. I'm hungry. Can I eat? Well, sir, your blood sugar is really high, so let us get it under control first. Can I at least have a drink? I can get you some water. No, something else without sugar, like juice. You're kidding me, right? A middle-aged lady in theater once told us at the last minute, as she was being wheeled, then that she's allergic to latex. Everyone freaks out cause so much of the stuff we use in theater has latex in it, so we take her to the latex-free theater and do her surgery there. When she's in recovery and awake, I inquire as to what reaction she has to latex. I just don't really like the sound the latex gloves make, dear. I just turned around and walked out. I actually have had to doozies in the last few months. I was rotating in the seeing a 20-year-old female patient who came in for a few days of terrible vomiting. First step was to get a urine pregnancy test, which came back positive. I went in and gave her the result, and she got this very panicked look on her face that quickly turned to confusion. She looked at me with the most serious face and says, I just don't know how this happened. I have only let him finish in my mouth a few times, but I have never, ever swallowed it. That would just be stupid. The next half hour was spent discussing the fact that she had been having unprotected sex for about 3 years because neither her nor her partner understood how pregnancy occurred. Best part was they apparently usually always used condoms for oral sex, but not vaginal sex. Much education was given on that day. Second, I was seeing a patient in a preoperative clinic and reviewing her history and allergies. She claims, and firmly sticks to it, that she is deathly allergic to all salt water, bad, red, painful rash all over her body, all at the beach. She was also claiming to be allergic to snow, where she apparently her face got all red and hot after being out in the snow. She was dead serious and had no psychiatry problems. Good news, she got saline and didn't die. This isn't the most uneducated, but it's pretty classic. I work in pediatric critical care. At my first job, we had this kid that was immediately post-op from a small surgery, doing great, was probably going to sleep it off and transfer to a general floor the next day. The mom wanted to snow him with drugs and kept on insisting he had pain, which he denied, and had no vital signs or actions to suggest he was hiding. He was getting scheduled oral opiates and Tylenol, but this lady was insisting on something IV. When she didn't get anywhere because the kid kept denying pain, she asked for something so he would sleep through the night, and the nurse said, "We can try some Benadryl," and the lady snapped. She demanded a doctor, berated the nurse, and essentially said we were mistreating her child, who was moo. Oh my god. I'm finding the whole time as he played Xbox. The doctor on service was this awesome, brilliant man who was tired of dealing with this lady drug seeking for her kid. He put on a smile, asked what the concern was, listened to her complain about how the nurse had offered the kid Benadryl, cocked his head and said, "Well, what about diphenhydramine? Have you ever tried that? It's a very effective sleep aid." For anyone that doesn't know, Benadryl is the brand name for diphenhydramine. They're the same thing. Immediately the lady perked up and said, "Diphenhydramine? Yes. Yes. Let's try that." Meanwhile, the bedside nurse is struggling to keep from laughing, says, "I'll go get that," and runs to the Pyxis drug dispenser in a locked room where she loses it. Kid got his diphenhydramine. I had a patient try to feed her newborn baby a French dip sandwich a few years ago. Work labor and delivery for a few days and you'll wish there was a license required to breed. My dad worked in a Philadelphia hospital during his residency. He says that one time he was asking a woman about her medical history, and she told him that she was once diagnosed with fireballs of the Eucharist. It took him a minute to figure out that she meant fibroids of the uterus. Fireballs of the Eucharist sounds like a really cool Christian FPS. A doctor said this: I noticed that all the patients sent by a particular doctor were freaking out badly when they came for their MRIs. Now some patients are claustrophobic, but each and every patient. Well, that is odd. So I called the doctor and asked her what she was telling the patients. She said I tell them that having an MRI is like being stuck in a coffin and buried. Don't eat or drink anything after midnight before his 3-year-old daughter's surgery. The next morning, tonsils and adenoids. While intubating his daughter the next morning, she vomited scrambled eggs, causing her to aspirate them into her lungs. Her heart stopped, and I did chest compressions on her for 25 minutes. We got her back, aborted the surgery, and transferred her to pediatric ICU on a ventilator. Her father's response: she said she was hungry. I thought you were being too hard on her. It must have been something you did to her. Oh man, I'm not a medical professional yet, crosses fingers. But early this semester we had a girl in my lecture literally argue with the professor how she's allergic to water. She kept going on about how she had to buy a special water and can only drink Gatorade vitamin water. Reason: it makes my skin dry. No idea where she was going with that one. Haven't seen her in class for a while now. Outpatient medicine. A patient walks in for normal follow-up and is obese. Tells me she'd read chocolate is good for your heart and had been eating 3 Snickers a day diligently. Poor woman. Bonus: lady told me she proudly never receives vaccines. I asked why, and she said the influenza vaccine she last received stopped her heart. I thought maybe anaphylactic shock or something, but no, because she wasn't hospitalized or received any treatment. Her legs had mysteriously later mildly swelled at the ankles, which could be a lot of things. Asked her how her heart restarted, and she confirmed it was still stopped. When a patient is told her unborn child has an XXY chromosome, she replies, yes, there's a gay aunt in the family. Apparently, the baby's mother thinks that sexual orientation is passed down in the family by inheriting an extra sex chromosome, Klinefelter syndrome. Patient 23Y. OF. I've been nauseous for the past week and vomiting the past 2 days. Emmy, are you sexually active? Patient: yes, me. Any protection? Patient: not really. Emmy, when was your last normal menstrual period? Patient: funny you should ask, it's late this month. Emmy: oh. Knew a girl in school that got pregnant at 16 and didn't know until she started putting on weight, and her mom took her to the doctor because she thought the daughter had an eating disorder that was making her fat. The girl said she couldn't be pregnant because she taped a penny to her belly button every time she had sex, just like her mom told her to do to prevent pregnancy. Yes, the mom was an idiot and gave BS advice to her very sexually active daughter instead of getting her on the pill. I'm a vet and met a lovely lady with a puppy the other day. I asked how old he was just to be friendly, and because my dog was saying hi. He was only 10 weeks, so I inquired if he had been vaccinated, again out of concern that I could pass something on to her pup. She told me that she didn't need to vaccinate her dog because he was on the lead and that vaccines were designed to give her dog autism. I just walked away. I really want to know how a dog with autism behaves. My dog is almost 3 and hasn't ever said a word. Sometimes he sits like he is in a world of his own. It takes several verbal commands to get him to do anything. He does socially inappropriate things, like sniffing the butts of other dogs. He enjoys repetitive tasks, like retrieving a ball which has been thrown. Jesus is all I need. Died of a simple flu at 14 years old. I work in a hospital, but am not a part of the treating staff. I just get to deal with the craze side of things. 8-year-old Bo, turning blue in lips, hardly moving, babbling. Blood test comes back. Potassium is so low child's heart is about to fail. Child has other issues. Drive. calls for emergency medical transport to a children's hospital in Tampa. Both the mother and grandmother say just give him the prescription, we will pray to Jesus to save him, it will be fine. We have bingo later and I'm not driving to no Tampa. They remove the child's IV and head outdoor. I inform them they are making a horrible choice. They must get the child treatment, he is near death. They say but we have a hair and nail appointment, Jesus will save him. DCF is called and with police escort they are brought back. Young male and female come in ER. Female is pregnant. Male keeps asking questions. If I have lots of sex with her, will it make the baby mine? If it hurts when we pee, that just means the baby is upset we had sex. Guy with open wound to leg via chainsaw. Blood gushing out. Guy is turning white. They cut off clothing. Remove shoes. Shoe is full of blood. Other is covered in it. They hit his leg with clotting agent. Bleeding seems to stop. Patient runs out of ER. Saying he'll be fine. Patient located dead an hour later. Blood loss. Wound began bleeding again. Was found in car in a parking lot. Family outrage that we threw out his new shoes. Older man comes in. Really bad shape. Stage for cancer. Children come and demand he be released. He's doing better. He's doing better, they say. All the while he's no longer responsive. Lost ability to walk. He's near the end. Kids, get a lawyer. Get control. Power of attorney. Take him out of the hospital. Guy calls for an ambulance. 2 days later comes back in severe pain. Kids show up and sign him out. A. Guy is crying and fighting to stay. Kids lift him up into truck, him crying whole time. Turns out kids stood to get hundreds of thousands upon his death. Just wanted him to go sooner. This was said by daughter. He gonna die. What do it matter? We gots to use the money. After that stuff, things just get sad. Things get to a point. Yethaphapan would even roll their eyes. People are horrible at times. This lady was morbidly obese and had already lost a leg to diabetes. While on the basic medical floors, she and her family would consume large quantities of fast food. She couldn't lift her own chest up enough, and she eventually went into respiratory failure and ended up on a breathing machine in the ICU. When we finally wean her off the machine and the tube gets pulled, the very first words out of her mouth are, "Can I get some fried chicken from the cafeteria?" An ex of mine was treating a patient that was admitted for severe contractions and was far along in her pregnancy. Patient, can you give me that shot so my baby doesn't get AIDS? Tim, you failed to mention you were diagnosed. TT, I don't have it, but I know there's the shot they give women when they are pregnant so the baby doesn't get infected. You can't make this shit up. Someone I know who worked in medicine once told me that a patient requested that his father's brain be swapped with that of a pig's in order to keep him alive following the news of an inoperable brain tumor. Can't make this stuff up. 5,000 and a bottle of Jack and I'll give it a shot. My friend is a nurse who works in labor and delivery. After following up on a teenage couple who had just given birth, she tells the new mother she did really well with her labor, her body would bounce back, etc. Without missing a beat, baby daddy interjected, "See, I told you all that fisting would help." I once had a patient out of his mind on opium insists that he was turning into a zombie because his blood was dry. Just kept screaming at us and begging us to kill him. Once I had an older patient in the ICU who was going downhill fast, and his daughter asked if she could cut his penis off and save it after he died because that's what made me. Not me. Doctor friend of mine. Young couple comes into I and she complains of vaginal bleeding. Doc asks if she's pregnant. Macho BF says no way. Legs in stirrups and there are two very tiny feet sticking out. Sends her up to surgery to have the baby removed. Goes out to talk to BF to explain situation. BF freaks out and yells that doctor doesn't know what he's talking about because there's no way that his girlfriend is pregnant. Doctor looks at him, says unless she was masturbating with a Barbie doll, she's pregnant. The next sound you heard were two nurses running into a room, closing the door and laughing so loud that everyone could hear them. Working in the I had a patient come in with a history of recent double lung pneumonia, hole from a tracheotomy still in her neck with signs of severe respiratory distress. She was booted to the front of the line because she couldn't breathe. Then a mother sitting with her 16-ish-year-old son screamed, "Excuse me, we were here first, are you F***ing blind?" Her son had a cold. Not the patient, but the family. The patient was in critical condition, intubated, sedated, on vasopressors, and the family brought in a bunch of tacos. After explaining that the patient couldn't eat because he had a breathing tube point to the tube and a ventilator that was giving him life support, the family paused and said, "Yes, but can we put the tacos down that tube?" Pointing to the breathing tube. I live in a highly populated Hispanic community where food is love and can cure anything. I had a patient that had a huge abscess on his jaw. He ended up going to surgery to get it drained and extract the infected tooth. He comes back on the floor and is still spitting up globs of blood into a basin. I leave the room to get something. I come back to the room and he is making out with his girlfriend. Tongue and all. Sometimes stupid actions speak louder than stupid words. There's too many stupid things that I hear working in a pharmacy. People think they know more about medicine than pharmacists and doctors. For example, this lady wouldn't listen when everyone told her not to consume alcohol while taking metronidazole. She pulls out a bottle and drinks liquor to help her swallow the tablet, and leaves the building. She comes back a couple days later from a hospital threatening to sue. Thanks for watching. Share your stories in the comments.